to reopen leisure activities and establishments such as cinemas and theme parks in GCQ areas.
The IATF postpones the opening of cinemas and other leisure venues to next month. The task force says the implementing rules are still up to the LGUs.
I'm one with the economic team na buksan ang economy pero gradual para sa akin. Hindi natin pwedeng biglain. Sayang yung gains that we have had for Metro Manila.
Doon po sa iba po natin pagbubukas ng ating po mga establishment, wala po against ang ating Metro Manila Council. Hinihintay lang po namin yung guidelines, yung specific guidelines para po sa iba. Kasi hindi naman po uma-against ang MMC sa pagbubukas sa economy.
Marikina is ready to vaccinate 10,000 residents a day as it has prepared cold chain and monitoring facilities and vaccination stations under the Marikina City Mega Vaccination Facility.
Quezon City, meanwhile, is being challenged by the presence of the COVID-19 variant in one community. But as Metro Manila is awaiting the arrival of COVID-19 vaccines, mayors are deferring the reopening of movie houses as they have yet to manage the COVID-19 crisis in their areas. Is it too soon to even think about the reopening of cinemas? We discuss in this episode of The Chiefs.
And welcome to this Monday edition of The Chiefs. Of course, with us in the studio is Robbie Lampay of One News, and also with us our Ana Marie Pamintuan of the Philippine Star, who is not yet online, but Lucy Cruz Valdez, the head of News 5, is now with us online. Lucy and Robbie, good evening.
Robbie.
Hi.
And happy Monday.
Evening.
Okay, I've been advised we have to go jump to our guest already kasi baka he may have limited time with us. So let's bring in our first guest for tonight. We bring in Marikina Mayor Marcy Teodoro, who joins us live. Mayor Teodoro, thank you for joining us and welcome back to the Chiefs.
Good evening and thank you also.
Good evening, Mayor.
Good evening, Mayor.
Mayor, we do understand the concern by the Metro Manila mayors dun sa proposal to open the cinemas already up to 50% capacity. However, ang argument po ng economic team is that they want to open up the economy. Kayo po, from your perspective po, what would make you change your mind or the other mayors change their mind and allow for an opening of the cinemas, at least to a limited extent?
An efficient and effective implementation of the vaccination program, I think it's imperative and as a prerequisite in opening other economic activities at this point in time. It's a problematic proposition, easing up quarantine measure at this point, given the data that we have. A surge in COVID-19 cases might happen, and our efforts, our gains that we have attained in the last few months might be put into naught or be countermanded because of our easing up at this point of the quarantine measures, particularly in opening cinemas and other entertainment establishments.
With that timetable po, parang it almost sounds like you're looking at the third quarter, if at all, if you're talking about a good vaccination program already in place.
I think it's contingent that our decision be based on data analytics and on experts' recommendation and opinion on the matter. The problem with this announcement of opening cinema, it came so sudden without proper consultation even to the LGUs concerned. There's a collatilla in the guideline of the IATF that the mayor will have an oversight on the opening of the cinemas and other similar establishments. And that's the reason why, in particular, here in Marikina this morning, I issued an executive order invoking local autonomy and in the exercise of the General Welfare Clause of the Local Government Code, providing that local chief executive can exercise appropriate, incidental, and necessary powers in order to ensure public health welfare. Yung data namin dito yung number of cases is still not flattened. Yung curve is not yet flattened at gumagalaw yung numero namin. Kaya we deem it necessary not to open cinemas.
Yeah, Mayor,
baka maging super spreader ito eh.
And Mayor, I was going to ask you kung nakonsulta kayo, pero nasagot nyo na eh. And therefore,
No, no.
that's why my next...
To be candid about it, no.
Yeah, and that's why I want to rephrase my question and reframe it. What's going on? This is the second time. I mean, before there was the matter of reopening malls, there was the matter of allowing allowing minors to go out, and every time there's this pushback, and every time we have this conversation as to whether or not the LGUs were consulted. Has that never improved? And to be fair, are the protocols to you actually should be clear enough?
Yung discussion na ganito mga deliberation on the protocols, on the guidelines is becoming after the fact after everything has been announced, we will discuss protocols and guidelines. This is really a problematic proposition. I think a whole of government approach is not happening in this matter. Kailangan talaga synchronize yung efforts at yung mga decision between the national and the local government units. Kami yung narito nasa ground, kami yung nakakaranas. In fact, when we heard the information coming from the IATF, I consulted some cinema owners here in Marikina, in our city, if they are also in favor. They have some apprehensions that without a proper protocol and guidelines to follow, viral transmission, there's a greater risk that increase in number of COVID cases will increase in the city.
Actually, yun nga rin well, that's the question in my mind, no? How much of a stimulant will cinemas really be? I mean, because it's always a question of balancing, the health aspect and the economy aspect. So I'm wondering if this will really contribute to a large extent to, stimulating the economy and encouraging consumer spending. Mga sine, malaki ba talaga ang contribution nun?
Luchi, I have the same question with IATF when we're having meeting. What's the basis of the proposition, and is there really a necessity to open up cinemas? I think we should be more focused, for example, on manufacturing, on agriculture, food production, processing, food processing, to ensure that work areas in this sector be COVID-free. Pero ito hindi risk to a possibility, an opportunity to have a super spreader. Spending 2 hours in a cinema in an air-conditioned area, there's a study saying that it will increase by 18.7% transmission. Ito yung statement ng mga experts, and I think it's important that we should listen to our experts. We realize the fact and we recognize that there should be balance between health and economy. Pero data should be provided, figures should be discussed, and clear protocols and guidelines should be given to our people. Kanina, nakikinig ako doon sa balita, Robinson manager, movie manager, cinema manager, miski sila, sabi nila, hindi sila makapagbukas dahil wala yung protocol, hinihintay nila yung guidelines. Bakit gano'n? Bakit nauna yung announcement bago dun sa protocol?
But Mayor,
having said that, they've moved it to March 1, assuming that they will be able to lay down the protocols by that time. Will you agree? Will you agree to opening it up? That's 2 weeks from now.
And candidly, I think the 2-week period, they're deferring the opening is to convince the Metro Manila mayors. But how can we be convinced without the data? It's not a political decision that we could simply agree. Somebody in authority saying to us that cinema should be open. Kung may naglabi man for the opening of the cinema, we should be transparent. with the information. And bakit nga? As economic stimulus, ano yung effect nito? Alam natin mahirap, maraming nawalan ng trabaho nung walang palabas na pelikula, buhat sa production, up to the exhibition of the movie. Pero ang peligro diyan, baka pag nagbukas tayo, dumami ang kaso, may resurgence of COVID cases, then we revert back to the previous condition of ECQ, which is more harmful to the economy.
Mayor will be, we will...
In the long run.
Mayor will be bringing in shortly Ami Pamintuan of the Philippine Star. Just a quick question. Kasi po, ayun nga, nabanggit nyo na, you have the national government there, you have IATF, you have the local governments, and then you have the private sector. But as you said, you have been talking to representatives of the private sector itself. I don't have a clear picture, but maybe you could tell us, where do you sense the pressure is coming from?
It's from the economic cluster of the IATF. Offhand, I think they're the one pushing the easing up of the quarantine measures. We agree to that. But there should be a system that will safeguard our gains against COVID. For example, no sinabi natin mag-open up ang economies. We should provide our workers with a safe and viable public transport system. But where's that viable and safe transport system? Pag lumabas ka, makikita mo, ang pila sa mga sakayan, congested, siksikan ang mga tao. Nasaan yung monitoring natin ng mga social distancing in our public transport system? One precondition in opening up our economy is that we should have a robust healthcare system. Do we have a robust healthcare system? Pag na-hospital ka pa rin, tinatanggahan ka pa rin sa hospital, wala ka pa rin mapuntahan na hospital. Siguro it's a question of viability and sustainability on our efforts in the fight against COVID. It cannot be reactionary at all times.
Let's bring in Ami Pamintuan of the Philippine Star.
Good evening, Mayor.
Good evening, Ma'am Ami. Good evening.
Hi. It's interesting that you issued an executive order. No? Are you setting a precedent here? Like if you don't want what the IATF is doing, can we be seeing more of these executive orders? Halimbawa, example lang, in the choice of vaccines. If you are given, for example, vaccines that you know your constituents don't like, pwede nyo bang sabihin na ayoko niyan and you issue an executive order? Basta you will be doing more things on your own.
I think the mayor, the local chief executive, has the authority to ensure public welfare and order in the exercise of of local autonomy. Of course, the supposition here is that we are invoking the general welfare clause, a provision of law in the local government code that we could exercise incidental, appropriate, and necessary powers bestowed upon the local chief executive in order to protect the interests of the public. In this case, ensure public health welfare.
Halimbawa,
It was a precedent when I signed this today, this morning, an executive order that stating that all cinemas in the city and other similar entertainment establishment remain closed.
Meaning kasama yung mga gaming arcades?
Kasama, sinama namin ito. Pati yung mga theaters, concerts, of similar museums.
Yeah.
Kasi hindi namin nakikita na na essential at this point in time.
Yung park?
Yung mga theme parks, yes. Okay, yeah.
Okay yun.
Yung mga theme parks na medyo walang social distancing ang kasama. But we have here in Marikina, for example, a Marikina River Park. It's an open area, 11-kilometer stretch. Ito, open to public since it's by its nature, open talaga to. It's by the river. So our some people, individuals that we have, since allowed naman yung physical exercises, we allowed in that area. But we have assigned protocol officers, health protocol officers in the area to enforce quarantine measures and other health protocols.
Mayor, just for...
Napayagan nyo na rin ba, sir, yung mga 15 to 17?
Hindi natin pinapayagan.
Hindi kayo
Hindi.
sang-ayon doon?
Hindi kami sang-ayon doon. Dahil para saan at for what purpose, ano? Siguro, kung mag-a-access sila doon sa essential services, for example, health, or they need to go to a doctor, or may emergency talaga, o may family, very important family activity that they need to be present, we do some, we give some consideration.
Mayor,
So do we take it to mean that you're not ready yet to move into MGCQ? Kasi yun yung inaabangan di ba? Hanggang end of the month na lang daw muna yung GCQ. But are we ready for MGCQ?
It's important that we move towards MGCQ for the sake of our economy. Marami talagang nahihirapan, nawawalan ng trabaho, ng pinagkakakitaan. So, kailangan i-approximate na natin But there should be a concerted efforts, I think, a whole of government approach, a whole of community approach for us to be able to achieve that condition of MGCQ. We aim for that and we work for that. That's the reason why we are very proactive in our testing, in our contact tracing, in our quarantine measures, para ma-achieve yun. Yun ang gusto natin But prior to that, we should be able to define clearly the health protocols that we need to impose if we're going to MGCQ. And I think that is what is lacking at this point in time. Clearer, a definitive health protocol, a stricter health protocols towards MGCQ. Hindi po pwedeng mag-MGCQ ka, based on our experience, na ilalighten mo or i-ease up mo yung mga health protocols.
Well, Mayor, just for context po, I don't think they want to open the cinemas for the benefit of the movie industry. I think they want to open the cinemas because they're a major crowd drawer for malls.
Yes,
and
correct.
they want to spur the
yeah.
economy by spurring consumer spending. At tanda po ninyo yun, nung panahon natin, yung mga pelikula, nasa labas ng malls yan sa Cubao o sa Quiapo, di ba? Pero magmula...
Yun Ed.
Ha? Kailan nangyari yan?
Nagkakalaglagan tayo. but I think that is the argument that they have in mind to spur consumer spending by bringing more people into the malls through the cinemas.
Yeah, as a stimulus, yes. We understand that. Even the lowering of the age restriction, gusto nila baka maging stimulus. Pero baka there are other options available that we could explore to stimulate our economic activities and to improve on our consumer spending.
Anyway, Mayor, malinaw naman ngayon yung concerns nyo. If you don't mind, I still want to talk to you also about your own preparations for the arrival of vaccines. Kamusta na po tayo? At the LGU level, I don't know if Marikina's preparations are typical or not, but what's going on at ground level right now?
First, we have an existing cold chain facility that could accept any kind of vaccine that can be delivered at this point. Meron kaming vaccine refrigerator na para sa sub-zero or negative temperature. Meron din para sa 2 degree up to 8 degrees na temperature requirement. We could store in that facility up to 200,000 vials or doses of vaccine. That's good for at least 100 individuals to be inoculated. We have also trained profiler and experienced vaccinators. We have the logistical preparation 2 weeks ago, we opened our mega vaccination facility, having 10 stations in that area. It's an open area. It's in the Marikina Sports Complex. Also in that complex, there's an infirmary or a treatment area for individuals that will experience adverse reaction once vaccinated. We put up an indemnification fund, similar to what Singapore has, for individuals who will be experiencing adverse reaction. Not that we are expecting
Yes.
adverse reaction, but to build up confidence and trust for individuals who will be inoculated. Mabuti na yung alam ng tao kung may mangyari man, merong pwedeng magamit para sa pagpapagamot niya at pantulong dun sa pangkabuhayan ng pamilya niya.
But speaking of which, Mayor, it looks like yung logistics mukhang kontrolado naman, ano? But yun nga po nabanggit nyo, yung confidence. Kamusta po yung confidence level among your constituents? Are you seeing the same numbers, or are you doing better or worse, or are you just in the same boat as everybody else in terms of raising the confidence level among your constituents?
I think we are similarly situated. But aptly described, what we're experiencing or sensing here in Marikina is what we call cautious optimism. Everybody is optimistic and happy that vaccines will be available the soonest possible time. But there's cautious, people here are being cautious. Nagiging maingat dahil with the recent experience in Dengvac siya. Hindi naman natin sila masisi. Kaya saka yung ibang information that they're receiving from other sources. That's also the reason why we put up a task force, a panel of experts. We organize them into a panel or to a group that can conduct the information campaign for not only for the vaccine that will be used, but for the process of the vaccination, to explain also the necessity and the efficacy and the need for vaccination for us to be able to achieve several objectives. First, to reduce yung comorbidities of COVID-19, deaths, fatalities, and second objective, and more importantly, to achieve what we call herd or population immunity that will bring us back to normalcy. So, nag-ipon kami ng mga doktor, virologists, immunologists, known in public health, infectious disease. Tapos sila yung nagpapaliwanag ng process of vaccination. Coming from the private sector, this is a whole of community approach that we're trying to do here. Mahirap, mayor lang ang nagpapaliwanag. Mababa yung minsan mababa yung yung una, yung knowledge ng mayor medically limited. Pangalawa, mas mabuting experts. Siguro para lang i-build up yung confidence, pakita ng mayor siya yung publicly inoculate para.
So kayo po, Mayor, mauna kayo. Are you going to choose what vaccine you want to have injected on yourself, or kahit anong ma-approve ng FDA?
I will let the experts, our panel, to determine what vaccine can be used. For example, in my case, nag-submit na ako ng profile ko, yung eligibility ko, ini-establish nila. And kanina, happy naman ako, I received information from the profiler that I am eligible to receive the vaccine. So, sabi naman nila, at my age and with my medical condition, pwede ako kung ano man yung available na darating.
So magsasample kayo ng sarili nyo, Mayor, ha?
Hindi kayo mamili po,
I understand that you also have a 10 million indemnity fund. No?
Yes, correct. Yes,
yeah,
correct.
para saan po yun? Pakipaliwanag po.
Nagkaroon ng adverse reaction. Yung aming process, Ma'am Lucy, very simple lang. Siguro ito lang yung pinagkaiba namin sa ibang city. Yung ibang city may 6 or 7 step process. In our city, what we did is a 3-step process only during the vaccination day. Registration and validation. screening, nando na.
Okay.
Prior to the day of the vaccination, ipo-profile ka na, may intake form ka ng pipil outan. Pagka-take mo nun, i-assess na yon, i-evaluate na yon, magka-counseling na kayo, not on the day of the vaccination, prior to the day of the vaccination. Tapos, we'll get your consent if you want to be inoculated. Pagkatapos, nabibigyan ka ng reference number. So, yung reference number na yon, meron ng date, may oras na para hindi sabay-sabay na nasa vaccination area. Tapos pupunta ka na ron, tapos bibigay mo na yung reference number na yan. So pag na-validate na ikaw yun, konting screening lang, temperature, vital signs, tapos proceed ka na doon sa vaccination. After the vaccination, baka sandali lang yan, baka walang 2-3 minuto, doon ka na sa observation area. Kung nasa observation area ka, yun ang gusto natin na bigyan ng pansin. Ready na rin ang Marikina for the support drugs that we'll be needing. We have purchased the support drugs, the facilities nga in place na rin, doctors that will attend to individuals who will experience adverse reaction. Kung kailangan mo ng treatment, dahil may reaction ka, adversely nag-react, doon kukunin doon sa indemnification fund. Kaya walang fixed amount para doon sa isang tao. Kasi depende kung ano yung kailangan niyang treatment. Kung kailangan siyang hospital o kailangan obserbahan. Kung hindi siya nakapagtrabaho, i-assess namin. Kung siya lang daily wage earner siya, kung siya lang yung naroon nagtatrabaho sa pamilya, siyempre affected yung economic well-being ng pamilya, we will provide.
So para siyang health insurance in a way,
yes,
no?
Yes,
for the
correct,
adverse effect, parang ganon.
Oo,
Okay yun,
Ma'am Lucy, correct.
Oo.
Kasi tinatanong nga ako sa'yo, magkano ba, Mayor? Hindi. Depende doon sa assessment na gagawin kung magkano yung kakailanganin mo. Kaya yung ating indemnification fund sa Marikina ay sabi ko nga, will be supplemented from time to time by appropriations coming from the City Council of Marikina. I think the national also is trying to put up an indemnification fund, and they're having, I think.
Pwede pala kayong mauna, Mayor. Pwede pala mauna mga local. Kasi yan nga istorya, national government is preparing that kind of fund. Pwede pala isa yung mga local government.
Yes, Ma'am Ami, pwede. In fact, kaya nga ako nag-put up, narinig ko sa national, nagpo-put up sila, pero natatagalan And we cannot be solely dependent on what will be provided by the national. Exercising the whole of government approach. Ang Marikina naman, maliit lang ang budget. Paulit-ulit ko sinasabi to. Pero I think there should be allocation for important purposes like this one.
Di kayo nag-Hall of Nation, Mayor. Actually, ang sinabi sa amin, lahat ng Metro Mayors payag na dun sa 15 to 17 years old. Na palabasin, yung pala, Marikina pala, hindi payag.
Ayaw.
Ma'am Ami, kasi nung tinignan ko yung huli naming data analytic nga, ay yung data ng COVID, gumagalaw sa amin Pero kung sasabihin ng IATF at magkakaroon ng resolution, uniform resolution sa Metro Manila, we will oblige to comply with the uniform resolution of the Metropolitan Manila mayors. Pero at this point, if they will say that it will be left at the discretion of the particular LGU, then we will decide what is best. On contingent on the data available to us. May testing kami kaya nakikita namin yung galaw ng numero, saka medyo real time na yung testing namin. Mabilis na yung result namin. So, na-analyze namin ngayon agad. For example, ngayong araw, meron kaming ni-lockdown na isang food processing plant dahil may isang nag-positive doon sa area. So today, nag-contact trace at nag-test. And hopefully by tomorrow, makuha na yung test. At kung negative naman, we could immediately open and yung production ng processing plant na yan ay can continue. I think that's the advantage of having one's own testing center.
Okay. Marikina Mayor Marcy Teodoro, sir, always a pleasure to have you with us.
Salamat po.
Thank you po.
Salamat,
Ingat po.
Mayor.
Salamat sa oportunidad.
Good night.
Thank you. Good night.
We'll just go into a break, so please stay with us.
Total number of COVID cases in the country have reached the 550,000 mark.
The health department has identified 34 hospitals which are set to receive the first shipments of Pfizer vaccines in the country.
Bagamat dinere-respeto natin yung mga desisyon ng mga lokal na gobyerno, sana maintindihan nila yung kadahilanan nito, no? Kung bakit ang polisiya is magpas.
Doon sa mga simbahan. Pumayag po kami, no? Pagkaalam ko unanimous po yun. Ang reason po nun is to be consistent doon sa restaurant. Kasi in restaurant, napayagan natin ng 50%. So, bakit naman hindi natin papayagan yung simbahan doon sa 50%?
Welcome back, the Chiefs here on One News. We're now in the final stage of our conversation. Now joining us is Quezon City Mayor Joy Belmonte. Mayor Belmonte, welcome po to the Chiefs.
Hi, good evening.
Good evening po.
Good evening, Mayor Joy.
Ma'am, kanina po kausap namin si Marikina Mayor Marcy Teodoro, and he was saying na nagulat din daw yung mga mayor sa announcement ng IATF na hahayaan na yung mga sinihan. We know that, notwithstanding the fact that there's a lot of malls, a lot of cinemas in Quezon City. Si Ed, may kinukwento pa na nung once upon a time daw, mga sinihan sa Quezon
Cubao,
City,
yeah.
nasa kalye lang. Wow! But anyway, Mayor, we want to get a sense, and I asked this also of Mayor Teodoro, where the pressure is coming from. I imagine you interface not only with the national government, but also with the private sector, a lot of mall operators, as we said. Is the pressure coming from the mall operators? Is there a clamor from mall and cinema operators to reopen cinemas?
Well, definitely not. Actually, I believe the pressure is coming from the economic sector or the economic cluster of the IATF because they believe that opening up the cinemas will probably help with the economic recovery. However, the question should be, did the IATF consult the malls and the cinema operators, because that's one of the things that I did when I first heard that cinemas were going to be open or were planning to be opened. No? And, I read in the news that cinemas, if you open them, will provide jobs for 300,000 people. So that to me was a little bit unbelievable. And when I spoke to the mall operators, or I mean the cinema operators in particular, they're actually quite apprehensive about opening their theaters. Now, first, they don't think it's economically feasible at this point, some of them anyway. And others were saying, even if we opened up, what would we show? There are no new distributors with any new films to show. So, and then I spoke to one mall with about 14 theaters, and they said, well, if we're allowed to open, we'll probably only open 2 or 3 of these theaters. So I really don't see the correlation between opening theaters and the economic growth. So I don't think that's the solution to the economic woes of our country.
Ma'am,
Mayor,
is there
this
any?
is the second time that the mayors have posed a suggestion of the IATF. And there's been a proposal for some time now that the mayor should be regularly consulted by the IATF on its decision making. What's the progress of this proposal?
Well, actually,
Matutuloy na siya.
In theory naman, kinoconsult kami, Ami, no? Like for
In
example...
theory. What is that?
Well, natatawa si Robbie. We found out about the IATF resolution opening up certain establishments. And then, of course, there was a discussion among the mayors. And then, now the IATF are going to meet with us on Wednesday. So, meron naman consultation, pero after the announcement.
For the fact.
Yeah.
Hindi, kasi parang ito na yata yung pangalawang beses na naglabas sila ng bagong guideline na ayaw ng mga mayor, tapos withdraw nila, tapos nag-usap muna. So we're wondering ano ba talaga ang prosesong sinusunod dyan between the IATF and the Metro Manila mayors?
Well, dapat talaga, I would assume dapat i-consult muna tayo dito sa Metro Manila considering that we are, quote-unquote, considered the epicenter of the COVID-19 problem. And of course, we are also the seat of the economy of the country, no? So I would assume dapat talagang makipag-usap muna sa mga NCR mayors, no?
Right.
Pero minsan siguro nakakalimutan nila kami and then pagkatapos nila mag-announce, syempre magkonting may media, so tatanungin kami, magre-react naman kami. So, naalala nila, ay, nakalimutan natin konsultahin yung mga mayors, tara mag-meeting tayo. So,
Actually, naku-curious nga ako how homogeneous are the cities of Metro Manila really when it comes to balancing the economy and the health needs in the pandemic? Are you really as homogeneous as the public seems to believe it, you know?
Well, actually, Luchi, no, we are 17 different local government units, and we have different characteristics, no. And really, when we're discussing amongst ourselves in the Metro Manila Council, iba-iba naman talaga yung mga opinion namin. But then we decided early on during the pandemic that rather than every mayor being autonomous from one another, we have to recognize that we are a contiguous whole. That what affects one city affects another city because we probably live in Quezon City but work in Taguig or Makati, and then do our shopping in Marikina. You know, so I mean, we cannot really separate ourselves from each other. So it is to the best interest of the entire NCR to actually have one policy rather than iba-iba yung mga policies natin. No? And kanina lang na we were having a meeting and one mayor said that he came out with a different policy at some point with regards to the age of children.
Yes.
He found out that everybody's children now went to his city. So napuno na inundate yung kanyang mga malls, no? So, and then he realized, wait, hindi yan ang gusto ko. I don't want that to happen, di ba?
So ang homogeneous pala, pasaway ang mga bata. Yun.
well, basta ang nangyari doon, napag-usapan ulit at napagkasundaan, sige, hindi na talaga tayo magbabago ng polisiya sa isa't isa. Let's just support one another. So itong cinema, hindi naman po kami lahat kami, walang consensus dito naman na lahat we didn't all agree. Some did not agree. Actually, some wanted the cinemas to be open. But then, they put it to a vote and the majority said that we prefer not to have it open. And for various reasons, hindi rin pare-pareho yung mga dahilan namin. And then, of course, sabi ng mga mayors, majority rules. And when we meet with the IATF, ito yung ipepresenta naming stand ng Metro Manila mayors.
Kayo po, ma'am.
What's the age na, 15 to 17? Kasi in-announce sa amin ngayon Metro mayors daw want to allow 15 to 17. Yung pala si Mayor Teodoro, ayaw pala niya.
Ayaw rin.
What about in Quezon City?
Alam mo, Ami, may difference between willing to tsaka want, ha? So, pag sinabi, eto yung proposal, okay ba to sa inyo?
Yes.
O sige, okay. Pero kung, for me anyway, I'm speaking only for Quezon City. I do the math. We are the biggest city in the metropolis. That's an additional 200,000 children already out in the streets. Just those two, the ages, 15 and 16 17-year-olds or 15 to 17-year-olds going out. I think that's more than 200,000 already. So, okay, I consult with the health experts. I say, kaya ba natin yung 200,000 additional people in the streets, in the malls, etc. And then I leave the decision to the health experts. No? And then they'll say, in this case, sinabi nila, kaya pa natin, Mayor, pero wag bababa sana sa 15. Kaya nung tinanong sa amin, are you willing? And the question is, do you want, not do you want, but are you willing? I answered, yes, we are okay with it. No?
Ma'am, in the case of the cinemas, what would make you change your mind and allow cinemas to open in Quezon City, for example?
Well, I understand, for example, that the reason why we're opening cinemas is for economic growth or economic recovery. So, for me, that should be the only reason why we would be opening cinemas at this stage, given the risk that the economic gains would far outweigh the health risks. And in this stage, wherein the cinema operators themselves are doubting the economic viability of opening up, saying they have nothing to show, and then being very, very afraid because of the health risks involved, wherein you're talking about recycled air, no ventilation, people sitting for 2 hours, exchanging, the air that they're breathing, not being sure whether we can actually enforce wearing face masks and face shields in a dark cinema, making people sit far apart when they're supposed to be on a date. I mean, ang hirap nun, diba? So ako, tingin ko, ang laki ng enforcement duties naman natin compared to yung economic gain dito. Tingin ko
because I was talking kanina with Yusek Vergere, and she was saying one of the conditions was the air cannot be recirculated. So I imagine there's a lot of retrofitting pa for the cinemas. May gastos pa sila bago pa sila mag-asam kumita.
Definitely.
At saka ang corny naman manood ng sine nang hindi kumakain, di ba? So pag kumain yun, bababa mo yung mask mo or your shield, no? So ang hirap i-control.
So, eto pa nga. So, kanina pinag-uusapan nga namin, so, sinasabi ng IATF, hindi madaming restrictions. For example, bawal kumain, bawal uminom, bawal magtanggal ng face shield, ng face mask, bawal katabi mo yung date mo. So, given all of these restrictions,
na lang.
Wag na lang.
Wag na lang. Tapos yung 300,000 jobs pa na sinasabing ma-generate na very doubtful, because given that napakauso na ng movie streaming sa Netflix, sa Amazon, sa Apple, ay ang dami ng options ngayon eh. So, tingin ko, pag pipili tayo, ako lang, this is just for myself, I'm just speaking for myself. If we are going to choose ways to revitalize our economy, I would not choose opening the cinemas as a first option.
Okay, Mayor, now let me talk about yung preparations for COVID. The last time you were here, you were saying registration is one of the things. I have to say, as a resident of Quezon City, I tried to apply for the Quezon City e-card. I have to say the website is very easy to use. But kumusta po tayo doon in the preparations, not just the logistics of bringing in the vaccines, but the matter of being able to track and to register and prioritize our citizens. Kamusta po sa Quezon City?
Well, dito, I feel quite confident, no? Well, una sa lahat, yung Quezon City ID card was our way of getting people to register. Now, I'd like to make it clear that yung Quezon City ID card is not just for the vaccination. It is actually a card that is meant to track our citizens and make sure that services are delivered easily to them, and also to make sure the services are going to residents of Quezon City. Nagkataon lang na nagkasabay. So we decided to put in a question, no, when you register for your ID card. And the question was, do you want to get vaccinated? No, so yung tanong, yung possible answers is yes, no, not decided, and why. No, and you'll be surprised kasi I saw a survey, Metro Manila, konti lang ang willing, no? Pero sa Quezon City, more than 50% are willing to be vaccinated, no? Tapos maraming undecided, konti lang nga yung ayaw, eh, no? Pero ang system now is if you get yourself into this ID card, yung unique number mo ay imamigrate or yung data mo, imamigrate dito sa EasyVax. Ano po yung EasyVax? So this is the system of Zwilig Pharma, and I'll explain to you why Zwilig is in the picture. Pero yung Zwillig Pharma's EasyVac system will now contain all of the questions that the DOH requires of you pertaining to your health and your other medical histories. No? And then when you fill that up, your data will now be migrated to this new system of the DICT, which is called the Vaccine Information Management System Immunization Registry. It's new and last Thursday lang namin nalaman na may ganito pala. No? And then when that's approved there, it goes back to EasyVax and EasyVax does all the tracking, monitoring, reminding of your schedules, etc. So this brings me now to Zwillig, no? Kasi yung ibang mga kasamahan ko sa NCR, lahat yan bumili yan ng mga cold storage facilities. Pero dito sa Quezon City, dahil sa laki namin, we really could not afford. I did the math, hindi namin kaya. We could not afford yung negative 70-degree cold storage. Yung medical grade na iba-iba yung lamig, hindi namin kinaya. So we decided to just partner with Zwillig, which has everything, and then let them do all of the work for us, basically, in terms of cold storage, and even of tracking and monitoring our patients. No? So yan yung strategy namin. And dito naman sa pagre-register ng ID, so far so good. People are registering, madali yung proseso, more or less. And ginagawa namin ay yung mga hindi kaya mag-online, we give them hard copies, tapos kami na yung nag-i-input ng datos nila. So mukha namang okay naman yung strategy na yun so far. And then in terms of immunization, we have 24 sites identified. All our schools, originations are covered courts because of the free flow of air and also the social distancing aspect. We have about 25 personnel per site, composed of marshals, inoculators, doctors, nurses, midwives, counselors. We plan to have 5 inoculators per site. Apart from that, in terms of comms, we have also a very aggressive communications plan because I do want to make sure that 80% of our people get vaccinated for the herd immunity. So we've been doing a series of lectures and webinars and fora for the past month already, inviting medical experts, not politicians, because nobody believes in politicians. And then,
Mayor, yeah. Go ahead.
And then apart from that, yun siguro yung main, no? Yung data management, immunization, cold storage, and data management.
Mayor, there are observations that dun sa ID card, hinihingi raw yung kanilang e-signature at bank account details. How true is that?
Well, it's optional. I want to say there are fields that are optional, and that includes, of course, your bank account details. Bakit optional yan? Kasi if you want mabilis yung ayuda sa'yo, halimbawa scholar ka, o kaya we're gonna download funds to you kasi ikaw ay isa sa mga beneficiaries ng ating stimulus package, no? Madali kung nandyan na yung bank details mo. So, mas mabilis ibigay yung ayuda sa'yo, no? Pero, it's optional kasi maraming taong natatakot dun sa breach of data privacy. So, optional po yan. Now, yung e-signature, that is necessary because this will be a official government ID. Ito po ay official government ID po. Kaya kailangan po talaga may pirma. No? Ngayon, lagi nagtatanong yung mga tao, paano yan, yung datos namin, etc., etc. Yan yung number 1 issue dyan sa ID. Ang sabi ko lang, simple lang. You want automation, you want digitalization, you want the new normal, you want convenience. You do that when you sign up in Lazada and Shopee and all of these other online shopping centers and the bank and and on your Netflix account and your apps, you give your details. So why won't you give it to the government? Because you don't trust the government. Ganun lang naman yun, diba?
Yes,
that's why.
exactly.
But you trust Lazada.
Every time
I'll be honest, yes.
Yes, diba? So every time I tell them that, the fact that we're going online, every time you put your data out there to go online for any purpose, you're already risking your privacy, no?
Right.
And so what we did, just to win the trust of the people, is number 1, we hired a cybersecurity firm to work with us. And then number 2, we also work very closely with the PNP Cybercrime Unit. So they help us monitor just to make sure that everything is in order in our system. No? Because there are hackers out there. You know that Senator Sherwin Gatchalian's credit card was hacked, so it happens, no? So kailangan one step forward ka lang lagi dito sa mga hackers. They're geniuses, by the way, these hackers, ha. Pero kailangan one step forward ka lang lagi with your data protection systems, no? And that's what we're doing here in Quezon City. And I want to reassure the people that this is something very important to us, no? Because for me, it is so important that we give services quickly, efficiently, and responsively. And I think this ID card will really work. Kasi one day, pwede nang sumakay dyan yung PhilHealth card mo, pwede nang sumakay dyan yung SSS mo, yung GSIS mo. Pero kailangan magtiwala yung taong bayan.
Mayor, doon lang sa punto na yun. This is a Quezon City card. Will this eventually sync with the national ID system?
Yes, that's the idea, that it will eventually sync with the national ID system and with national government services as well.
Okay.
That's the idea.
Mayor, you're a COVID survivor. Are you willing to get a COVID shot? Are you willing? And do you have any vaccine preference? And will you get it in public?
I am at the end of the priority list. No? So I do not want to jump the line because I don't think that's right. But I always say if it will help increase the confidence of the people in the vaccines for me to get vaccinated, I'm more than happy to do it. And I have no preference for as long as the FDA approves the vaccine that will be administered to me.
Yung survey niyo, you mentioned undecided. Anong reasons ang sinightness?
Well, yung undecided, yung mga reasons lang naman nila is natatakot sila, yung side effects narinig nila, may mga namatay daw sa Norway, yung mga ganyan, yung mga issues na puro nababasa nila sa social media. Kaya nakikita ko yung challenge doon is really to convince the undecided. Yung mga no, tingin ko no na talaga yan. Tsaka konti lang yan, less than 20%. If I want to achieve 80% herd immunity, kaya pa with the 20% no. Pero yung undecided talaga, napakahalagang playing field yan. Kailangan ko talaga silang i-convince. And that is why we're getting all kinds of experts to give lectures. And very targeted. Pag yung senior citizen, ito yung issue, senior citizens talaga yung papakausap ko sa kanila na napunahan from other countries, no? So we're doing everything we can to allay the fears of the undecided. And I'm just happy kasi in other countries, katulad ng Amerika, maraming hindi magpapabakuna dyan, anti-vaxxers on principle, di ba? Basta ayaw lang nila ng foreign matter in their bodies. I'm happy to note that in the Philippines, wala namang ganon. Takot lang talaga sila. Fear lang talaga yung kanila.
Mayor, before we let you go po, may phone-in question si Joby Francisco. We were talking about the cinemas kanina na pinapadali natin yung pagbubukas. Pero sabi ni Joby, meron daw mga boutique cinemas. Ito yung mga small theaters that are standalone independent that are already operating daw. And some of them are in Quezon City.
I'm not aware of any. I know only of two. One is in Anonas and one is Cinecentenario in Maginhawa Street. And I know yung isa sarado na for good at yung sa Anonas is closed temporarily. So if there's another one that I'm not aware of, I would be happy if our caller can let me know where that is.
Jovi, alam mo na.
Ayan, sabihin mo na sa akin kasi illegal yan. Hindi sila dapat nagbubukas.
Yes, just to be clear po, so dapat, kahit itong mga boutique cinemas, hindi pa siya pwede?
Hindi sila pwede. Hindi pa sila pwede.
Okay, sige, we'll forward the information po to your office na lang. Maraming salamat po, Mayor Joy Belmonte of Quezon City. Ma'am, maraming salamat for joining us tonight.
Thank you very much.
Salamat, Mayor.
Thank you, Mayor.
Thank you.
And that'll be all for this Monday edition of The Chiefs. We hope to discuss here will keep the conversation going. I'm Ed Lingao.
I'm Mami Pamintuan of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay, and we are One News.